Yes, of course. One type of oral preparation is combined oral contraceptive pills, COC, which is composed of varying amount of synthetic estrogen combined with a small amount of synthetic progesterone that help to reduce the possibility of getting pregnant because it suppresses ovulation, reduces sperm transport in the fallopian tube, and thickens cervical mucus to prevent sperm penetration.
Is it okay for me as breastfeeding mother to have this type of oral preparation to have breast control?
Good question. You cannot go through this method while you are breastfeeding because the estrogen level that present in COC will reduce breast milk production, which will lead to less weight gain for your baby. But the other type of oral preparation is progestin only pills, POPs, which is safe for breastfeeding because it does not contain estrogen.
I am breastfeeding mother. What is the best way to use PO method? And after stopping breastfeeding, can I start with COC method? If yes, how can use it and does there have any side effect?
In case of COC method, you can start taking it on the first day of menstrual period and continue take on pill every day at the same time. Or Sunday start by taking the first pill on the first Sunday following the start of your period and continue to take one pill every day at at the same time. While using this method might have a few side effects such as nausea, weight gain, headache, breakthrough bleeding, or depression, but this is all depends on your body because not all women have this side effect. In case of POP's method, you can start take it at any time during your cycle. If you start on the first day of your period, you don't need a backup contraceptive method. But if you start later, use a backup method for 48 hours afterward, and it must be taken daily without interruption to be effective. While using this method, you might have also little side effects such as headache or breakthrough bleeding.
Sister Muna, you said in the beginning that there is type of hormonal method applying through intramuscular injection, right?
Yes, there is. It's called Depo-Provera. It is a long-acting method form of birth spacing using only the progesterone hormone, and it is given by injection and repeated every 12 weeks.
Does it have any side effect?
You might have a few side effects while using it, such as spotting, breakthrough bleeding, irregular menstrual period bleeding, headache, fluid retention, edema, or osteoporosis. In case you would like to go through this method, I would like to advise you to have a diet rich in calcium to prevent having osteoporosis.
Wow, this really interesting and wide topic. Please, Sister Muna, can you tell us one more method that we can use, such as a device rather than checking or using something every day to have birth spacing?
Okay, there is a method which women can use for birth spacing, and it is intrauterine device.
What is it and how it is work?
This method happened when the doctor inserted the device into the uterus through the vagina opening.
How does it affect to prevent pregnancy?
It is a local sterile inflammatory response in uterine cavity that prevents implantation, and it has have effect in sperm motility.
Nice to know about it, but I have a question. Do all women can use this method?
Not all women can have this method because there are some cases the woman cannot use it, such as severe dysmenorrhea, valvular heart disease, history of ectopic pregnancy, or severe menstrual bleeding.
Okay, are there any specific notes that women should know in case she want to start with this method?
Yeah, there is, such as annual breast and pelvic exam, maintain high calcium intake to prevent osteoporosis, report if she develops spotting, breakthrough bleed, amenorrhea, irregular menstrual flow, headache,